going to be less suppressive in theory compared to something like long-acting injectable testosterone. I don't know if that's been clinically studied and with sperm counts looked at and things like that, but from a mechanism standpoint, that's what you would expect. So it could be a better option for someone who's trying to like bridge off of their TRT and thinking about, hey, you know, in the next year, I'm thinking about fertility.
Yep.
Because you really do need to start planning that farther out. Oral testosterone replacement therapy. Didn't we try that in the 70s and 80s?
We did. And people have also tried it on their own with D-ball oral-only cycles as well. So it used to be we had methyl testosterone, which of course is hepatotoxic. But a lot of oral steroids are 17-alpha alkylated. And that's why in general we don't use them anymore. But now there are actually there are 3 different, or maybe it's now 2, but there used to be 3 different lymphatically absorbed testosterones. Tlando is probably the most well-known one. And it is basically a lymphatically absorbed, so theoretically it would skip first pass metabolism. I'm not convinced that it does that 100%, but let's say it's 99%. It does drop SHBG. So either the level of 5-alpha reductase in lymph tissue is very high, or a little bit of it goes to the liver and hits the SHBG there. But in general, this is pretty well tolerated, and the concentration peaks after just a few hours and is mostly out of the system overnight.
Yeah, so it's going to be less suppressive in theory compared to something like long-acting injectable testosterone. I don't know if that's been clinically studied and with sperm counts looked at and things like that, but from a mechanism standpoint, that's what you would expect. So it could be a better option for someone who's trying to like bridge off of their TRT and thinking about, hey, you know, in the next year, I'm thinking about fertility. Because you really do need to start planning that farther out. And as far as the risk of red blood cell count going up, risk of blood pressure elevations, they're still there, but they're not as pronounced because, I mean, if we're looking at pharmacokinetics and you think of the area under the curve, so total testosterone exposure is going to be significantly less compared to you wake up and you go to bed with a total testosterone of 800.
Yeah, that's a good summary of oral testosterone. A few other notes on oral testosterone. I've heard a few forward-thinking urologists say this should be the new thing instead of Clomid for individuals under 35 or under 40 that are desiring fertility. I think it's probably too early to say that, but it is extremely promising for that purpose. And yes, you would think that even if you stacked it, now, you know, some people ask about stacking clomiphene and enclomiphene with TRT itself. Generally not a reason to do that, and there's much better options. But and even gonadorelin and other things too. But with this, it would potentially work slightly better if it was for a short period of time. But again, with these protocols, it's really too early to say. But the takeaway is it is a very reasonable option. A lot of urologists and endocrinologists are using it as well. And at some point, it will become mainstream. They are also studying the exact same molecule. It's an oral testosterone undecanoate. There's no depot site, so the esterases reach it very quickly. But they are studying it for fatty liver disease.
Yeah, how did they describe that? When I'm trying to rack my brain, it was described as a novel oral pro-hormone.
Prodrug.
Prodrug.
Because the esterase cleaves the undecanoate ester very quickly. Novel oral prodrug or pro-hormone androgen agonist.
Yeah, androgen receptor agonist. That was how it was described in the paper. And I was like, wait, that's just Tlando. But they're looking at it for fatty liver, which, like you, makes me a little bit suspicious that, wait, is this really bypassing the liver completely? Because then if so, wouldn't just TRT help with fatty liver? And, I mean, I don't know. It's interesting. So we'll be watching the research there because hepatobiliary health and liver health is becoming a growing problem. So, they're going to be developing novel or non-novel strategies to treat that.
Yeah. Last note on that. Yes, it does decrease SHBG a decent bit. And a lot of people look at this like a positive thing, but it is not necessarily a positive thing. It's still a good option, but it's an interesting way to see it.
Yeah, for sure.